Knock, knock.
Who's there?
It's Erin.
Erin, welcome to the show. How are you this evening?
I'm great. How are you, Gareth?
Very good, thank you. Very good. Welcome to the show. Thank you for being here. Thank you for your time and coming on and sharing a little bit about what you do and who you are. And for the listeners, Erin is a physiotherapist, among other wonderful things, which we'll dig into. And she's going to talk a little bit this evening about what she does. And we're going to share a great conversation. And this is going to be really useful for anyone listening today that is either had physiotherapy before, is thinking about having physiotherapy, is intrigued into what it might entail and or what they might think it is and what it actually is. And we're going to unpack all of that stuff and dig into that. So yeah, it's going to be some good takeaways. So with that being said, I am going to firstly hand it over to you, Erin, because I'd like you to share a little bit of, I guess, your journey. And I'm intrigued to know a little bit about your journey to becoming a physiotherapist, but also what impact recreation, sport, fitness, health, all those things had on that journey. So you can give us a snapshot of that. And I know you've done some pretty cool things and been involved in some great things, along the journey and in your career. So take it away.
All right. Well, maybe I'll start off with kind of like my fitness journey, because that kind of led to the physio journey. So I've always been active. My parents always encouraged my brother and I to be active. Neither of them were particularly sporty, but they loved being outdoors. We would go camping and canoeing and lots of hiking, biking, even some skiing. But they exposed me into a lot of different activities as a kid. I did horseback riding lessons for a couple of years, gymnastics for a couple of years. But my major sport that I played was soccer. I started when I was 5 and I just loved it. I've played every year since then. I've actually played soccer on teams in 7 different countries around the world and probably kicked a ball around in a few more. So that's just my thing. That's what I still continue to do weekly. I usually play once or twice a week. Just gets me out there, gets me active, gets me hanging out with I was going to say ladies, but also I play co-ed sometimes too, so that's fun. But yeah, just as a kid, just always outside playing around. My parents actually had a rule that if we wanted to spend an hour on the computer, then we had to spend an hour outside before we were on the computer. So I think that was smart.
Good rule. Yeah.
Yeah, exactly. In general, like we traveled a lot as a family, as kids. So when we were on holidays, we would walk everywhere. Hikes in the mountains, walking and exploring cities. We'd bike around some cities too. And so generally now, even when I go on holidays, I find I'm almost more active when I'm on holidays, just because I want to see as much as I possibly can.
Yeah.
So I think because of all my sports and activities, I had a few injuries, mostly from soccer. So I went to see an athletic therapist a few times and a physiotherapist a couple of times as well. So that kind of got me interested in that health side of things. In high school, I love science, especially like the health and medical side. But it wasn't until grade 12, my last semester in grade 12, that I took exercise science and learned all the bones and the muscles and physiology, and I just loved it. I thought it was great. So because of that, I went to McMaster University for kinesiology and studied that for 4 years. While I was there, I played intramural sports, which was fun, and won a couple t-shirts. It's a big deal when you're at McMaster, winning like the coveted t-shirts. And then I volunteered at the campus physiotherapy clinic as well. And I loved working with the athletes there and working with the physios, and I'm like, yeah, this is what I want to do for sure. So when I graduated, I took a year off and I worked as a kinesiologist at a chiropractic clinic. And then I worked just for 2 months as a kinesiologist at my current workplace, Fusion Physiotherapy. And then I went off to do my physio degree in Australia, which was awesome. So 2 years there, great university. They do a lot of research in physio in that side of the world. So it's really cool to come back here, and I've taken some courses here, and they're quoting information from some of the professors that actually taught me. I'm like, oh yeah, they had their hands on me. I had my hands on them. So it's kind of cool to see that their research is, so widespread around the world. So then when I graduated from the school in Australia, I came back to Canada and back to the same job at Fusion. And my boss gave me a job as a physio. So I've been there for 10 years now.
Nice.
And then it's been awesome. I love working in this town and with all my wonderful patients. And then, last year I decided I wanted a little bit of a challenge. And because of COVID, I wanted to start a virtual physiotherapy business. So I've been doing that as well in the past year, which has been really cool. Good learning experience.
Yeah. But I can talk to it's a very similar path of the transition from the skills in person to the skills online and how they vary and how it's a new skill set to learn. I mean, it has parallels obviously, but yeah, it's a great learning curve, I think, in so many people's career, and we can chalk it off as one of those things maybe we're grateful for from the last couple of years, which there's been a few, as well as the challenges. So a couple of things, and what I didn't actually start the show by saying today is that you are also our physiotherapist, as in me and Nikki. And you treat us, so this is how we got connected initially. We live in the same town, and I didn't mention that, and I've done a phenomenal job on keeping us both at work, in work, moving. Right. I guess.
Yep.
All of those things. So we're obviously very grateful for that, and a couple of things. So I'll go back through the kind of story a little bit. It sounds like the activity that you experienced and were surrounded by as a kid was very kind of influential in everything that you do, which it is for so many people, right? And I think we truly are imprinted a lot as kids, and as it comes to activity and health and well-being. And this is why I'm so passionate about this as a parent, and why so many of our members are, I talk to them about this with their kids and their family lifestyles. I'm like, you're imprinting those habits and those behaviors and the relationships with things like food and exercise and movement from a very early age. And a lot of us didn't have that growing up, depending on, age range. But for me in my 40s, I didn't have that as a kid growing up. There wasn't really a massively, I'm not going to say there wasn't a healthy relationship with those things, but there wasn't much awareness around it. So it does have a huge impact. And when you come from an environment like yours, it's obviously had a massive impact in not just your career, but, your life and lifestyle as a result of that. So I think that's a really key takeaway for anyone, regardless of whether you need to see a physio or not. Those things are important. And am I right in thinking that I've always heard that a lot of that, like you mentioned, the research coming out of like Australia, the physiotherapy schools, the physios that are leading the way in the industry are there? Is that kind of what you experience? Because I hear that a lot from many people.
Yeah, for sure. A lot of kind of like the fathers of physiotherapy, one is from Australia, one's from New Zealand. Okay. And they've been major influences in how I treat and the things that I've learned. And then just some of my own professors. It's been interesting, even like I said, recently taking courses and then teaching me. I'm like, I learned that technique already. I learned that from that prof in person. So, but I find the schools are very like highly rated there because like so much research comes from there. So many people travel from around the world to do their postgraduate studies and their own research in Australia and New Zealand.
Yeah, for sure. And do you know why that is? What is it? Just somewhere it like originated from, that kind of type of care? Is it something else that's impacting that and getting that information out from that country specifically?
No, honestly, I'm not sure why it seems to be such a hub for physiotherapy. It's also a hub for like med schools as well. So maybe it's a great place in the world to focus on the medical field. But honestly, I'm not sure.
Must be the weather.
Sure. It attracts the right people.
Yeah, maybe. That's awesome. And actually one thing, kind of a sidebar topic, because I think it's interesting, and I like to get to know everyone, or get everyone to know the listeners, to know everybody as well that comes on the show. How would you say overall, and this is a very broad question, and there's no right answer, of course, how would you say living in another country and or studying, and for anyone listening, this always fascinates me, how do you think that impacted you along your journey in your career? But obviously it's affected that, but just in life in general, like how was experiencing that with more than a 2-week vacation? How did you
Mhm.
find that kind of impacted you?
Yeah, I've had quite a bit of experience. I was very blessed. My parents love to travel, so we actually lived in Germany when I was like 5 and 6, and in Ireland when I was 11 and 12, and then I lived in Australia. So it was great just to, yeah, like you said, not just travel and just be the tourist, but also get to know the people there and get to know their lifestyle.
Mm.
Um, and you really get to engage with them. I found in Australia, maybe because I was younger in the other countries, but in Australia, generally they're more active there. And again, maybe that has to do with the wonderful weather and access to a variety. Like they have mountains there, they've got obviously lots of ocean to play and swim in, but yeah, I think just getting to know them and their lifestyles and how they interact with each other and their relationship with exercise and fitness and, yeah, food, nutrition too. It's influenced by different places around the world. Like Australia obviously has a totally different uh, growing, not growing season, but
Yes, I know what you mean.
growing conditions.
Yes.
That's where I learned I love mangoes.
Oh yeah,
Mhm.
that's
Yeah.
pretty up there on the list of top fruits, I'd say. Yeah, it's so
Yeah. So I
interesting.
don't know.
It's so interesting. I always think it makes a big, just little things like that, right? It really broadens your view
Mhm.
of life in general. I found, and just it's funny you mentioned that. Like that's living in New Zealand was the first time I realized that you had to shop in season and what that meant, because I grew up in England and you never did that because everything was from Europe. It didn't make any difference. You can get anything you want any time of the year, especially
Right.
fresh produce. Doesn't work like that when you live on a tiny island in the middle of nowhere.
That's right.
Yeah, and you're like, oh, it's summer, 3 avocados for $1, and then you're like, oh, it's winter, 1 avocado, $5.
Yep.
And you
For
learn that
sure.
pretty quickly, right? So it makes you realize how, and there's so many other things, right? There's culture and there's the way things, people are different, the way you communicate is different, and it teaches you so
Mhm.
many great skills, which I'm sure has impacted your ability to be a well-rounded physio, as is it mine as a fitness professional.
Yeah, that's right.
Yeah. So yeah, that's huge, and it just always interests me. I love to hear people's thoughts on that, because it's something that fascinates me, and I've loved to travel and been very fortunate to live all over the place as well. So yeah, always good to hear. So what I want to dive into a little bit is, obviously you heard about many things around the world of physio and your journey. What I find, and although think it's very common knowledge to me to know what physiotherapy care is, I don't know that it's that common, because I get asked quite a lot, and obviously I'm no expert in physiotherapy. So what I would like to do is just kind of, I guess, give us a broad overview and just your opinion, or the industry opinion, whatever, it works, is what is physiotherapy care? Just a kind of broad kind of statement, your thoughts on that, just to paint people a clearest picture as possible of what it is that you do.
Yeah, physiotherapy can treat a variety of different conditions. When I went to uni for it, I got into it thinking, okay, I'm going to be like an orthopedic musculoskeletal physiotherapist, which is what most people view physio as. Working on a muscle strain or a tendonitis, something like that, right? But I remember when I started, they were like, well, you're going to do a practicum in the hospital working like with cardiorespiratory patients. Why am I going to do that? How is that related to physio? But so I think that was kind of interesting to learn why it's so important, why we have to take care of our cardiorespiratory health and how we can recover post surgery, whether it's just a general surgery or heart surgery. And then we also did practicum in neurological placement, so like stroke rehab, um, stroke, Guillain-Barré syndrome, which some people have heard of. It's pretty nasty neurological one. Spinal cord injuries. So there's all sorts of different areas that physios can help in different environments, whether that's in hospital, in acute care, whether it's in a rehab hospital, when you're recovering. But then there's, like I said, my kind of what I viewed physio as is working in a private clinic, working with bones, joints, muscles, tendons, all that. Yeah, so such a variety of injuries out there that we treat, that I treat anyway in my area of the field. So muscle tears, muscle pulls, tendonitis, rotator cuff tears as well. You might just have knee pain, like, so sometimes they call it jumper's knee or moviegoer's knee, neck pain, back pain, even when you get a pinched nerve, some people complain like got sciatica or pinched nerve, pain down the leg, numbness, tingling, all that can just so significantly impact your life. So physios are a major part of recovering from that.
Yeah. So it's kind of managing really anything that's structural, skeleton, and any muscles that are attached to it. So basically the bits of the body that move us, as well as you mentioned, the cardiorespiratory system. And I think for anyone listening that is, kind of getting that clear picture, and that really helps for sure, is, if it's not something that you're receiving in a hospital, as you said, as a recovery from something, as a patient, it's more kind of, I have something, we'll call it wrong with me, but for want of a better kind of clarification of that, but feeling something in your body and what it could be, and not knowing is, going to a physiotherapist there's such a broad range. And that was what I really wanted to highlight, because I think it is, some people maybe wouldn't seek that help. Maybe they would go to, and this is not to say that a doctor's not going to help you with it, but to go to their regular family doctor, general practitioner, with something that maybe a physio is the best person to seek advice from, right? Like I hear that a lot. I speak to a lot of people in maybe older generations where I'm like, just go see the physio. And they're like, but I have to go to my doctor first. I'm like, no, you don't. I'm like, if it's this, and this, obviously I have a great working knowledge that I've been going to physios for, well, I worked in the fitness industry, so I played a lot of sports. So I've been going to physio for a long time, since I was about 16. But it's great to hear that. It's great to hear there's a really wide ranging topics, and you would see it across many different environments too, right? Like, as you said, it may be the hospital, it may be many different types of environments. So I think that really highlights it to a lot of people. I'd love to also hear kind of a bit of a rundown of the types of care too, for anyone that's maybe a bit apprehensive or maybe isn't sure what will happen. Am I going to go in and I'm going to get like beaten up, or have needles stuck in me, or I'm going to get this machine or that? And to kind of paint that picture, is what kind of different things do you do as a form of care?
Right. And the other thing I just wanted to add to before also is, it's not everyone has pain. That's what we think of when we go see physio. Oh, I must have pain. But you don't have to have pain. You might have tightness or stiffness, or you might just have pins and needles, numbness, right? And those are major issues that are caused from like a structural cause, like you said. Yeah. So depending what the issue is, that's what physio can help with. So you might even have a specific goal. It might not have any, you're like, hey, I want to be able to run a marathon, but I want to be able to do it without developing an injury. Yeah. Right. So sometimes it's great to do some like prehabilitation for that as well, or before a surgery. A lot of people have, knee replacements, hip replacements. So patients will come in before their surgeries to get as strong as they can beforehand, so that the recovery is just that much quicker and smoother. So in terms of when a patient starts seeing a physio, whether that's in person, whether that's virtual, we get a good history of what's going on. We do that interview and just say, okay, so tell me what your complaints are, whatever that is. And I try to get, develop a pattern, when does this bother you? When does it feel better? And, how long has it been going on? Was there a specific cause, or did it come out of nowhere? Because lots of things seem to come out of nowhere. Or something little like, hey, I just bent over and picked up that pen, and all of a sudden, like, my back went out. Yeah. So when you come in, we start with that, and then we'll do that physical assessment. So again, I'm going to ask my patients to do some movements. Might want to see them walk, might want to see them run, might be bending, might be looking at your sitting posture, testing strength, and all these things you can do in person and virtually. You just modify it a little bit, but it's amazing how well it actually works. And then comes to treatment, if you're in person, then everyone expects hands-on, right? Most people want to be touched. There's a few people who don't actually like being touched.
Yeah.
But sometimes it can be uncomfortable, but I think it's important as a therapist in general to communicate with your patient and just say, okay, hey, it's going to be a little bit uncomfortable when I kind of poke around in here, but you just let me know if it's too much, and we can adjust things. So we do a lot of manual therapy. So that's doing some massage techniques, joint movements, joint mobilizations. So that can just be as easy as, moving your shoulder up and down to kind of gliding within the joint, which is something you can't do to yourself. And then we'll do exercises. Exercises are probably what physios are most famous for. Because it's so important in your rehab, right? We need to be able to strengthen parts of your body. We need to be able to loosen up or gain mobility in other parts. So exercises are critical in your rehab, but also long-term in preventing reoccurrence. Yeah. And then sometimes in person, you'll get modalities. We call them modalities. So that could be acupuncture or dry needling. And you can do IFC, or a lot of people have heard of the TENS machine. So that's like the tingly machine. Yeah. Those are great. I love the tingly machine. It's a great temporary pain reliever. Is it going to fix it on your own? It's not what the research kind of shows, but it facilitates healing, and it does feel good, which is great. Yeah. Sometimes when you're in acute pain, you just need to feel better, right? We have ultrasound. Some physio clinics have shockwave therapy. And laser therapy. So there's all these like electrical modalities that can be used. Some of them are totally pain-free and some of them are painful, but your physio should tell you ahead of time what to expect.
Yeah. Mm-hmm. Well, that's a great overview. And I think there's many things that you'll hear that I'm kind of reminded of that I forget exist. And, many people may have not heard of before and understand that that's kind of part and parcel of that. I love that you touched a lot on how important the exercise and the movement is. And obviously I'm passionate about that. For anyone that listens is fully aware of how passionate I am. It's important because this is a common complaint that I hear a lot, and it goes across physios, massage therapists, chiropractors. Doesn't matter what the area is that person's working in, but so many people say, oh, but yeah, I don't like insert practitioner of some description because I went once and it didn't fix the problem. Yep. Yeah, that's like the person that says, well, I went to the gym once and didn't achieve every goal I ever wanted. Oh, of course you didn't. It doesn't work like that. And in case you weren't sure, and I think that's where people go, well, I'm going to go here and I'm going to get fixed. I'm like, no, you're going to go here and you're going to figure out probably what's wrong with you. You're going to get diagnosed. And then that's where the journey starts, the path to whatever it is, right? Whether it's preventative or whether it's, pain or whatever, you're going there to start that process. And I think if more people went in understanding that it's a process, and and a journey through the care, that they'd be a lot more successful, but they'd also understand the accountability. I don't have to tell you this because I'm sure you've experienced this lots of times in your career, where there's no accountability for doing the stuff that needs to be done, and no one's going to be, I'm sure there might be a few people, but I don't know there's many people that have got the disposable income to be going to the physio 5 days a week, 3 days a week, right? It's that stuff in between. And, and obviously I see this as, a career in personal training. Yeah, it's 2 hours out of your week. You're coming to see me. Like, don't expect miracles in 2 hours a week if the other things don't happen. So that's so impactful, and it goes across so many different areas of health and wellness and everything else. Yeah.
Yeah, that's a really good point, right? If you're not going to do it for more than 2 hours a week, then you shouldn't expect very many changes, because it's not just exercise, it's your whole health in general, right? Whether it's sleep and getting outside and certainly nutrition, right? And your mental health as well. It all plays a huge role in how we feel physically.
Yep. Yeah. And that's, and I've always, sworn by having that, right? Physios, chiros, and massage therapists, like always having those bits in place and understanding it's a juggling, especially when you do something physical. Like I've been doing something physical since I was 17, all day for a job. the likelihood that I get through that unscathed was highly unlikely, right? So
Yeah.
anyone that's doing something, and sometimes we've got to be aware that you do something physical, you get the risks involved in that, right? The repetitive strain, the constant stuff. But also anyone listening, it's like, well, I don't really do anything that active, so that's not going to affect me. I'm like, the opposite's also true. That all day static doing the same thing with your body. I might be putting it under load and stress all day from an activity standpoint, but lots of people are putting it under stress from sitting at a desk all day, which we're also not really designed to do, right? Or whatever it might be.
Yeah, 100%. I think like sitting still, being still is almost the worst thing you can do for yourself, unfortunately, right? But nowadays, more and more people are spending more time at sedentary jobs. Not everyone, obviously, but it seems like the majority of jobs are like that.
Yeah. Well, we're moving more towards a lot of that stuff, right? So much stuff is in that direction. Like look at, generations coming up now and what we're looking at. There's kids making millions of dollars a year on YouTube. So it's and not that there's any criticism of that, because the world is what the world becomes, and that's that. But it's so true. There's so many less active things becoming real. There'll always be place for those other things, but I think there's a generation of people that are going to have a lot more problems from being in a static posture as opposed to being in, I don't know, like a more of a manual labor style thing, which obviously has those issues too. So yeah, good to be aware of. So that paints us a really clear picture. So thank you for sharing all of that. I guess we kind of answered this, but the other thing I was kind of wanting to touch on is, I guess, who should see a physio? Like if anyone's listening, and that kind of gave us a clear picture of what you do, but that person's thinking, oh yeah, it kind of sounds like that, but maybe I'm too injured, too old, too young, too out of shape, too whatever it is. And we tell ourselves these stories all the time. So I'm assuming the answer is going to be everybody, but I'm sure you'll have a more we can articulate that a little bit better. But who should come and see a physio?
Yeah, like you said, short answer is everyone, potentially. Like I said, it doesn't have to be pain related, right? It can be, you can have all these different issues. It could just be a mobility issue. You might have a different goal. You might say, I want to be able to get on and off the ground easier so I can play with my kids or play with my grandkids. Or, a lot of people get a diagnosis of diabetes and they know that they need to change not only their diet and nutrition, but they also need to change their physical activity. And sometimes physios are a great way to just start that journey, as well as osteoporosis, right? Because that is a potentially dangerous thing as you get older, because if you do fall, you do break something, it takes a lot longer to recover. So physio and resistance training in general, not just physio, can help you prevent osteoporosis and kind of and manage it, like slow down its progression for sure. It doesn't have to progress. So resistance training doesn't have to be weights. It can be body weight. It can be bands. All that stuff is so important. So yeah, I mean, other than what we did a whole list before, all the different injuries and joints and muscles and tendons and ligaments and discs and everything going on in your back and your neck, right? There's so much going on. Even rehab from shingles. I've had some patients who have had shingles, and normally it just kind of resolves on its own, but some people have neurological deficits after, where they have some weakness, and you have to work on strengthening that specifically to get back. So they didn't have any pain, but they need to get back into regular function, right? So if you're missing anything, whether it's from shingles or just from, sitting at a desk all day, if you find you're not as functional as you'd like to be, it's not as easy to go up and down the stairs or do your laundry or, go for that walk, then physio can be helpful.
Yeah. And, that's the message across all of those different fields of health and well-being, right? It's so important. And I love that it does kind of span across everybody. I think the thing that I talk a lot about in the world of health and fitness, which I'm sure is relative as well, when we're talking about physio, it is for everybody. And anyone with any all the things you mentioned should be considering it. I think the one factor that I talk a lot about is it's a bit like health and fitness. Everybody really has got to be doing some sort of movement, health and fitness, getting those things in, right? There's reasons that strength training are important, cardio training is important, et cetera, et cetera. What I always say is it's not that it's not about who should be doing it. It's sometimes more about who you should be seeking to help you with it, and making sure that you're comfortable. So it's, just like I said, people are saying to me, why should I come train with you? I'm like, well, just come train and see what you think. And if you like it, great. And if you don't, there's billions of other trainers. Same with the physio. You've got to find someone you're comfortable with. And that's the last thing I want, is someone to come in and not feel comfortable in an environment that I'm delivering something. And I'm sure you're the same. So I think it's less about us thinking, well, maybe it's not the right thing for me. Maybe I don't need to go to physio, or I don't need to see a trainer, or whatever it is. You probably will you will definitely benefit from it. It's now finding an environment where you're enjoying the interaction, you're enjoying the type of treatment. Like you said, some things are, oh, I don't want to go there because they're going to do something I don't like. Find someone you feel comfortable with so that doesn't happen. It's a bit like if you come and say, well, I don't want to join the wonderful online, Nock Academy platform, or whatever it might be, that you don't want to, because I think they're going to make me do something I don't like. Okay, well, come find out or ask, and I'll tell you. And it might not be for you, and you might not feel comfortable in that, and that's okay, because there's as there are billions of fitness professionals, there's heaps of physios too, and you can find someone, but find somewhere where you're going to feel comfortable and you're going to enjoy. I don't know how much I ever enjoy physio, although I enjoy talking to you when I come. Is find something where you're going to enjoy that, because then you want to go back. You enjoy the interaction, you like the type of care, just like health and fitness. If it's miserable and you hate coming, I'd almost, it's not good for business, but I'd almost rather you don't come if that's how you feel about it. Like, go and find something you do enjoy. Maybe walking's for you. Maybe you take up a sport, whatever it might be. So I think that is, now I realize that would have been a way better question, a point, than who should come, is who should you find to help you with it? But I think it kind of goes hand in hand.
Yeah, you're 100% right. Like, you have to have a good therapeutic relationship with whoever your therapist is, physio, chiro, massage, whoever it is, and with your fitness professional, whether it's, training or it's a sport. If you're not enjoying it, you're not going to do it. So you're not going to get the benefits from it. And I know you've said that many times before too. You got to enjoy it. So you find something you enjoy, so you're consistent with it. That's the biggest thing, right? So that's definitely true with fitness, but also true with your physio, because if you don't respect your physio or your therapist, then you're probably not going to listen to them. You're probably not going to get better as fast as you would like, unfortunately. So there's lots of people out there. Find someone who works for you, and that's totally okay. It's not to say one physio is better than another. We have different levels of experience, and some of us specialize in different areas. But you have to find someone who you connect with. That's, I think, the most important part. Yeah.
No, so true. That's the best word that I didn't use. Someone that you connect with. Absolutely true. And yeah, you gotta, like you said, you gotta find it. You gotta make it fun. You gotta be consistent in everything we do in life. It goes outside of health and fitness and physio care and everything else. So yeah, super, super important, and some great points, some good takeaways. So next thing I wanted to touch on, I think, and this is kind of from a standpoint that a lot of people kind of want to hear, that they're the kind of person that's going to go to physio. What's going to happen when I go? How am I going to navigate that? The other thing I'd love to hear, and this is also just purely out of interest for me as well, is what are the most typical things that you see in patients when they come to you? And I don't know if that's hard to kind of nail down, but over the last 10 years is what has been the most typical thing, and maybe what are some of the causes of those most typical things. So I think people will relate to that and kind of join the dots up as to whether it's something for them.
Right. So in terms of like specific reasons why people come, specific injuries, usually, low back pain, probably, I don't know, I have top three. I'm not sure which one's number one. Low back pain, neck pain, and shoulder pain. Those are that's what I say the top three are. And then, you get knee pain and all the other stuff, but those are the top three. So it can present so differently in different people. It might be, oh, I hurt my back doing something really active, like taking a dock out of the water. Yeah. Or I hurt my back. Yeah. Like I said, just bending over to pick up a piece of paper. That shouldn't hurt your back. Right. But sometimes these little things do. So I'm not sure if that has answered your question.
Yeah, no, definitely. Yeah, it can be a wide range of things. And I think it's important to know that people do turn up with back pain for doing something like picking up a piece of paper. okay, you don't need to be embarrassed about that, anybody.
No.
I've had some of the most ridiculous injuries. It happens. Our bodies aren't bulletproof. And that was kind of where, where I was going a little bit with that. But I can definitely confirm that I have been to a physio, a chiro, or a massage therapist for back pain, for neck pain, and for shoulder pain pretty consistently over the last 20 years. So it happens to us all. And, you put your body under a lot more stress in different environments, it's going to happen. So, but, you mentioned a few things that are everyday life, which I think is important too. And this is where your health and fitness and the movement things that you choose can support that, right? Pulling, a dock out the water, maybe picking things up, maybe picking up your kids, doing sport and activity with them, right? We all have that as parents. We have that like activity, like we're active, we play sport at college, we do all these things, and then we stop, and then we get a job, and then we have kids and we're like, I remember I can do all these things. And then you figure out pretty quick that you can't. As I found out a lot of times, like, ow, that hurts. Ow, this hurts. So yeah, know that, and know that we can continue on that journey. Like it, and it's also not too late to start that again. If you're in that point in life where you're like, I need to, like you said, it's you want to be a great grandparent or a great parent or whatever it is, and to our market that we speak to in the Nock Academy is, busy parents, that it's hard to continue that, that schedule of movement and exercise and make sure that we are strong and we've got good longevity to be there and be an active parent. It's tough. So, keep that up, and it's important that you do it and make, physio care and massage and all those other things part of that routine, because that's going to be that preventative side that, I never even thought about in my life until I started to get injured. And I'm like, oh yeah. So maybe don't always leave it, like you said, till you're in pain. Think about it before that.
Yeah. Oh.
So that seems like a really good segue to talk and plug a little bit of exercise and movement and how it's part of. We always mentioned how it was part of the kind of physio care plan, and what we didn't say is that we were connected because you are both mine and Nikki's physio, and we see you on a regular basis. But also you are a member of the Nock Academy. So I would love to. I'd love to get a perspective from your kind of just experience, but also from a physio, from someone in a professional world where the body and the movement is there. Is what is that experience like when you exercise and you do something that's not. And not that you should know everything about health and fitness and movement because you're a physio, but it's in your category and in your world of speciality. It always intrigues me as to what your experience is like. But I also in that want to talk about, how finding, and we've talked about it a little bit, but more so finding the right exercise routine, finding the right, something that's balanced, something that gives you a little bit of everything you need is so important from a physio standpoint when you're prescribing that to your patients and recommending them and sending them to somewhere that is going to give them that. That was a very long question. Go ahead.
All right. Yeah, no, I've really been enjoying being a member of the Nock Academy. I love your variety of classes and trainings. Like I haven't done them all yet. I haven't tried it all yet, but I think that there is something out there for everyone. And if you do have, an injury or something that's affected, and maybe you can't do, high impact, maybe you're able to do, a cycling class or some yoga. So I think it's great to have that variety. I enjoy, well, I don't know if I enjoy it, but I like doing your HIIT classes.
The strange enjoyment. I know what you mean.
Oh yeah. I'm kind of cursing you afterwards, but but I know they're really good, and I find them worthwhile for sure. Because it's just important to have that strength aspect in the HIIT, and as well as that cardio aspect in the HIIT. But I know you offer those classes kind of separately as well. And so I think as someone who's looking for different ways to exercise, you got to find what works for you. Like we already talked about. You might be like, oh, I love the bike, but I'm never going to do yoga. Like yoga is just not my thing. Fine. You don't have to, right? That's okay. But it's also great for those who are injured or who have certain limitations. And they're like, okay, well, I don't have a bike, so that's off the table. But I have space in my house, so I can do yoga and I can do strength and I can do, some mobility exercises. And then I find that you guys are awesome at always providing modifications. If you need to make things easier in some way or harder. And you also point out, you're like, oh, hey, Erin, I know that your ankle's sore. So if you can just, take out the impact by doing this instead. And so I love having those options. I find that really helpful, worthwhile, because even though I'm a physio and I know like how I can adapt, sometimes in the moment, I'm just like, oh, what should I do instead? I want to keep moving, but I don't want to do that thing. So you guys are always just pointing it out, making it really obvious and easy to adapt.
Yeah.
Mm-hmm.
Yeah, it's so important, right? Because even from a place of and I say this all the time, people always ask me, well, do you get coached? And although I currently don't have someone that's training me, I read a lot, and I research other people's training techniques, and I have had coaching in many different environments. And say, well, why do you do that? Don't you know what you're doing? I'm like, yeah, but when my heart rate's at like 90% and I'm on the last rep of a massive set or the last 5 minutes of a workout, sometimes my technique's not so great, or I'm not finding the range of motion that I should be using, even though I know exactly what it is. I'm not watching myself. I'm dying on the inside. The last thing I'm bothered about is how low my squat is at that point in time. So it's important to have that. And I love that you said that, because I think it highlights that we all need a coach in some way, shape, or form, whatever that looks like. And that coach might be your physio, that coach might be your fitness coach, that coach might be a business coach, could be anything. But
Mm-hmm.
we all need another perspective and view on movement. We need people to watch either what we're doing or see what we're doing from a business capacity, or looking at our body if it's a physio, and how we're moving. So it's so important that we all get that. And also thank you for your kind words.
No, I've really been enjoying it, so thank you.
Yeah, well, we love having you, and it's always nice to have people with another another view, and to hear what you think, and to get feedback on that. I know we love that as a business, because it only makes us better. And as we said, it's part of that balanced exercise regime, and it's so important for everyone, for you, for everything you do all day at work as a physio, right? Like, you're using your body, you have to be very aware of that stuff. You need to stay strong, if you're doing a manual job, or like you said, you're a parent or a grandparent, and you're trying to navigate what the weirdest, strangest things you need to be strong for as a parent, that you never thought about until I was a parent. Then I'm like, oh yeah, I got to be able to do this, and I didn't realize.
Yeah.
So that's massively important. And I love that you touched on the balance, and we do kind of pride ourselves on delivering a schedule where we have the kind of almost and our members listening right now are going to be laughing, but we're almost, in the most positive way, trying to manipulate what people do based on a schedule, to say, okay, across lunchtime, most of the same people come at 12:10, for example. So we're going to try and just manipulate, because people love what they love to do and don't always love the other stuff. I know this stuff I need to be doing in my training, and I have to force myself to do it sometimes to keep balance, right? And I'm almost just gently persuading people in the scheduling subliminally that this is the kind of things you need to do to create that exact balance, right? So we're not overloading too much of the same thing. There's not too much high intensity impact work 5 days a week where we're going to end up, well, it's going to be good for you because they're going to end up in the clinic with you fixing their injuries. But it's important that you get that balance. And that's, now you've heard it from me and you've heard it from Erin. So everyone listening, do that. It's hard when you love to do something, but be smart about it at the same time is a really important message.
Yeah, that's 100% right. Like I said, I love to play soccer. I could do it every day, but it would be hard on my body. So it's great to balance that with strength training and different types of cardio training, and doing some mobility, flexibility training. Like, all of that is so important, just as we all talked about, that balance, that variety. Motion is lotion, I say. Keep moving. It's good for us.
Yeah, absolutely it is. And yeah, finding those ways. And I love that it crosses over, right? It crosses over to what you love to do. And I talk about this in strength training all the time. And like, if you learn these movement patterns, you strengthen these movement patterns, what will happen is when it's faster, quicker, you're tired, your body's going to be prepped for that. And that crosses over to whether that's in sport or just in another training session, right? Like you do the hard, slow reps with great range of motion in a slow, controlled environment. Then when you have to do them in the fast environment, it crosses over. Or it crosses over to the sport, or it crosses over to your running that you do in the summer, whatever it is. So there's always a place, and know that professionals, and I'm going to say good professionals because there are some that aren't, good professionals are looking at that stuff and saying, okay, this, and I talk to our members all the time, this is great. I know you love this, this, and this, but doing this as well is going to benefit the other things. It's going to cross over and make sure that you're more successful in everything you do. And physio care and massage and your nutrition and all your other bits of the puzzle contribute to that as well. So it's really being, I spoke about this only funny enough when we're talking about living in other countries, is the broad view of the world, the broad view of everything within your health and well-being is important. And we have to kind of embrace all of that stuff. So really, really important message.
Oh yeah, for sure.
Yeah. So what I'd love to do now is to hear, well, for the listeners to hear, and this is all going to be in the show notes today, so you can literally just one click on your phone, you'll find everything you need. But Erin, share with everyone listening where they can contact you if they have questions, if they want to talk to you in a bit more detail, if they're interested in virtual physiotherapy, and they're in Ontario, or they just want to, maybe pick your brains about something. Where can they connect with you?
So, you can email me. It's roamingelkvirtualphysio@gmail.com. Also my website, roamingelkphysio.com. And I'm on Instagram. I'm on Facebook. Follow me there if you get tips on, preventing injury, how to, treat some injuries, all sorts of different things on there. So those are probably the best ways to get a hold of me.
Right.
And I offer
Awesome. Well, and that's some great info. I am going to make sure that's all in there, so you'll be able to find that stuff. So if it's not safe to write that down or you didn't catch it, no problems. It will all be in the show notes, and I'll make sure everyone has got access to that. So that's awesome. Thank you so much. Well, listen, Erin, thank you so much for being a guest, for coming on and chatting and sharing all that wonderful information. It really helps when we have that super clear picture of what something is, a service that I'm passionate about and has helped me a lot. So, and I know a lot of people will get a lot from that. So really appreciate your time, and and we love you being part of what we do and also being our physio. So thank you for that on a personal note as well.
Thank you for having me. It's been a pleasure to treat both of you and to work with you at the Nock Academy. It's a lot of fun.
Awesome. Well, thank you so much. And everyone listening, thank you. Thank you for tuning in. I know you got a lot of good practical information about physiotherapy. I hope you enjoyed listening and had some fun along the way. And if you did get something from the show today, please share with someone you love and care about. We really appreciate it. That makes a big difference to, grow that message out to more people. And especially if there's someone maybe in your life that you think maybe could benefit from seeing a physio, that maybe has hesitated on it, or could benefit from maybe some online fitness options to help them towards their fitness journey, is we are here. So share it with them. They'll be able to get our contact details, and we'll really appreciate the support. That's it for today. Again, thank you for listening, and we will catch you on the next episode.